You will see the upper jaw. Upper jaw there is no implant, only extraction we are planning. Which tooth? No? 1.5 and 1.7. Okay. So this is 1.5 and 1.7 we are doing only extraction. We are not replacing. Just for theoretical discussion, we will see 1.5 now. See, this is 1.5. Alveolar bone is lost. After that, basal bone is also lost. That is why I used to keep always say, if the tooth is mobile, remove it as soon as possible. The more it is in the mouth, it is going to resorb more even the basal bone. Now we have only 2 or 3 mm bone. We can place implant, but immediate loading is quite risky. If you are placing 4 or 5 implants now, we can connect, but here only 1 implant. The implant will get attached only here. We see a basal implant. Here it will be long cantilever. So we are extracting, we are waiting. Let some bone recover.
So you give 3 months time or how is it?
Yeah, 3 months time. Then we can place.
Extracting and
Extract and wait. So this is 7. See the canine upper anteriors, they are good. There is no periodontitis. There is no gingival inflammation. But why only 4 has gone, only 7 has gone? Opposite which there might be some occlusal problems introduced. Okay. So maybe some lateral interference would be present. But this overlaying gums is good. Nobody can tell this much amount of bone loss has happened. This left side on this side. This is the right side. This is the 4 now. Maybe here lateral guidance might be more. This tooth, this tooth, this tooth. So this is called macroocclusion. We see macroocclusion visually or by taking photos and all. Okay, this is macroocclusion. But there is something called microocclusion. We don't know what is the microocclusion. So if you take T-scan, you will understand how much force is going to this tooth, this tooth, this tooth. And this tooth is slightly inward compared to this tooth and this tooth. It is slightly palatally tilted. Maybe that is the reason it is getting all the load and getting into it. And this sound also is. So if we take T-scan for this patient, it will clearly show where is the problem, which tooth gets moved first. So we'll start. So lower 2 anteriors and radius, and even mono implant is there. In Bangalore it is mono. So I don't have any experience with mono. I have used all this. Even radius is there. Radius is Gen XT.
Gen XT comes with both conventional and
they are having conventional implant also, right? So even Supraden they are having conventional implants. Okay. So each and every basal I will tell what is the difference. Okay. Gen XT also. Supraden is the oldest company dealing with this design. So their design is excellent, perfection, 200%. You need only pilot drill and twisted drill. That is enough for 99 situations. Unless the bone is very dense, you may need to use the 2.8 drill. But the violent drill, you need to use pilot drill, twist drill, and most of the time, many times, the 2-point drill also. Okay. The reason is, you can see this is the basal, violent basal, this is the Supraden basal. If you see, this shank is a little bit thicker here, right? Can you observe? So this shank part,
silver color is
Supraden. So the shank is thin. So that means in bioline, the shank is little thick. That means the thread it is less. How much the thread goes out is less. Okay. So it needs more bone removal. But Supraden is easier to insert. Pilot drill, Supraden basal you can place it. But violin you need to have a 2.8 drill handy. If it is not going, then you need to use.
So just 1 or 2 turns you are turning, and if it is not going, better to go with the third.
Yes. Sometimes even it won't engage also. Yesterday we used 2 basal implants. The implant is not at all going. It went 2 mm, but it didn't go, right? So we use the black or the 2.8. But if it is Supraden, it will go straight forward.
Engage
we have to use the 2.8.
No need to try to
No,
apply
it will only measure.
எதுவுமே
It will only it will only disturb the implant, the bone. The radius implant, the tip, it tapers rounded. I am not at all happy with this.
Next patient, keep us.
I am not at all happy with the radius basal implant because once you are giving torque, the implant itself it starts bending. Okay, so the material, the entire strength itself is less. So radius basal design is completely no. But the compressive is very good for beginners and it is very economical also. So radius compressive implant for beginners, they are excellent implants. They are very easy to insert. Okay. The same way bivalent 3.75 compressive also very good for beginners. 3.7 compressive.
So இதுல வந்து இங்க கீழ ரவுண்டா இருக்கு இல்லையா, இது வந்து அங்கேயே ஸ்பைரல் மாதிரி இருக்குமா?
It will be very similar to implant only.
Okay.
But the material itself, I am not very happy. It is very too flexible.
So, but we are not. We need not decide on the design here, right? When company, it's company's design. They have their own identity.
Yes.
But only thing is, we are concerned about the dia and the length.
Yes.
So, whichever is
Yes.
accessible for us, convenient, we can go ahead.
Yes.
So both the spirals are of equal length only.
Yes. See, when they are copying from, they cannot do the same exact copy, so they mild some.
So basal calculation எப்படி சொல்லுவாங்க?
Length is from here to here. From the
Compressive na veru namku
From
threads
thread to-
okay, from the
Okay.
apartment fruits.
Genexty I am not using, but anyhow I used for a long time. But I will tell what is the. Okay, the threads will be.
So I have a doubt here. இப்போ இங்க வந்து நமக்கு அந்த design of BCS and compressive இதுல இருக்கு இல்லையா, they give it from here to here the length the manufacturer, or it is we have
from
to
here.
take
The basal length is from here to here.
So abutment, that is not the height to be considered.
Abutment is
They
not
don't
at all included anywhere. So the
நீங்க
Genexty.
செலக்ட் பண்ண சொல்றீங்களா சார்? நீங்க 10 mm சொல்லும்போது நீங்க அந்த
I am measuring from the gum level if I am using basal.
So when we take the dia,
You
16
mention
mm,
only the length because
Yes,
they
yes.
know the thing is
Yes.
always 3 point.
Yes.
So if it is 15 or 16 whatever, so we take this measurement. Not this doesn't apply.
Yes.
அபார்ட்மெண்ட் அப்ளைவே கிடையாது.
Yes,
அதுதான்
yes,
கேக்குறது.
அதான்
Yes.
பண்றாங்க.
From
the
here
gum level.
you can take a scale and you can measure from here to
So
here.
இங்க இருந்தீங்கன்னா நமக்கு
See, basal 17 means it is only 3.6.
So அப்ப நம்ம
Oh,
செலக்ட்
that's what I
பண்ணும்போது
was-
5.5 we are using only 10 or 12 max.
Only
Yeah.
these two you are using.
Yes, 3.6,
So
5.5,
அப்ப நம்ம
4.6.
இம்ப்ளான்ட் நம்ம செலக்ட் பண்ணறச்ச இது நம்ம வந்து கரெக்ட்டா மெஷர் பண்ணிட்டு நம்ம செலக்ட் பண்ணி வாங்கணும்.
Yes. No. You have to have the stock of ஒரு average.
ஒரு
If you
டைப்ல
are, if you are, if you are planning for lower anterior,
Ah.
mostly it will be 14, 17, 20.
ஓகே.
It will
Now
be
only
3.6.
one we put 14, the other
17.
17.
We'll see the CBCT. See, whatever planning you are doing in CBCT, but it will there be mild change.
போலாமா?
அதுக்கு நீங்க compress
சரி நீங்க CBCT இல்ல, we have to go there and ask.
After taking CBCT, you will.
So you plan for compressive and you put BCS by
Place bone quality was good.
with
We can
bone
place
quality.
compressive also.
Compressive we should have put shorter.
The reason is the tooth was very close to the adjacent canine.
Okay.
If I put compressive, the tooth to implant distance will be very less.
Okay.
So if I put basal, the shank is only 2.8. So the natural tooth distance will be more. If I put compressive, it will come here. Right? So
If compressive, what length we should have selected? 11.
14 or
அதே 14.
இந்த 17 போடுற இடத்துல 14.
No.
No,
14 போட்ட இடத்துல என்ன போட்டுறணும்?
definitely less than 14.
அதான்
Ah,
less
12.
than 14.
12 because to adjust the gum level.